Hi, we're going to talk about the first 10 drugs on the top 100 list. Let's get started. All right, so the first one is Zestrol, also known as lisinopril. And there's another brand name called Prinavil. This is a prescription label I had printed for you so you could kind of see what they look like. It's kind of hard if you don't get to see them in person. And actually, I thought I would maybe show this to you. This is ibuprofen. It's a real prescription bottle. The X on there is what is put onto open bottles, but I want to show you. I might have to come up with you. Try to keep this in focus. Above the last letter, it says RX only. So all prescription bottles will say that. And they won't have consumer packaging types of directions on it. Very little. And by the way, this is ibuprofen, 600 milligrams, which requires a prescription. Over the counter is only 200. And yes, a person could take 3 of those tablets to make 600 milligrams. And sometimes they do that if their insurance doesn't cover this. So it's good to know that. So let's get back to this. We have the Pril, P-R-I-L, at the end of this, which will give you a clue that this is an ACE inhibitor. You'll see there's enalapril, lisinopril, Prinavil, benzapril. There's a few others. It's used for congestive heart failure and hypertension. And there's a boxed warning. The boxed warning is fetal toxicity. So it is very dangerous for a pregnant woman to the baby to be on this medication. So it's something to know if anyone very young is put on this medication. In fact, we don't see too many young people put on this medication, probably for that reason. So, and then there's the cough. The cough is something that I put down as something in your notes. It's a good thing to know. Cough later, after someone's been on this a really long time, can develop. And it usually entails someone going to an ENT, getting tested for viruses and coughs and, infections, and like a year later finding out they know they didn't have asthma or allergies, all those things. It was due to the lisinopril. So it's not that common, but when someone's coughing for a year and they can't figure it out, and then someone comes along and says, oh, look, she's on lisinopril, that could be the reason. So a doctor will then change the medication to something else, and if the cough goes away, they now have what's called a lisinopril allergy. So interesting, very interesting stuff there. So let's move on. The next one we have is Synthroid, and this is a thyroid medicine. You kind of can tell from the part of the word thigh in here, and there's really not a suffix or prefix, so I put down thyro. When you see that, you'll know it's a thyroid medicine. It's used for replacing the thyroid hormone in a person whose thyroid has been removed or is underactive, and it needs to be taken on an empty stomach. Okay, so that's 30 minutes before any pills or food for that day. And that's because there's so many minerals that can chelate to it. It binds to that instead of you, and then it doesn't get absorbed. So there's 12 different strengths available, and they start at 25 micrograms, go to 50, and all the way up to 300. Okay, so don't be surprised if somebody's dose doubles. It's not unusual. And it's, let's move on. Okay, so metformin. This is a medication whose brand name is called glucophage. Now, take a look under, over here, RX only again. You're going to see this on every bottle. Sometimes it's even hard to find, but that's why they call it a legend drug. That is the legend that needs to be on there. It is used for diabetes type 2, also known as non-insulin dependent diabetes mellitus. And if you take the acronym for what I just said, some doctors will write it that way on the chart. Contraindicated in renal disease. Contraindicated means they cannot have it in kidney disease. And major side effect for many people, over half of them, can have some degree of diarrhea. NV, which is nausea and vomiting, is also very common. Take it with food, and breakfast and dinner is optimal. No, it's not 12 hours apart, but that is what is recommended by the manufacturer. Now, the muscle pain, that goes with Zocor. This is a statin, simvastatin. And there's a lot of statins, I think, on the top 100, probably 4 of them. There's pravastatin, atorvastatin, rosuvastatin. It's for hyperlipidemia, which is for someone with high cholesterol. And that's what this does. It lowers the cholesterol. Avoid grapefruit and grapefruit juice because that causes a drug interaction so that the Zocor or the simvastatin doesn't even break down. And then it will actually build up in your body and circulate longer. And then you're taking another dose while you still have some in you, and you end up with very high levels, which can be very bad for your liver. Simvastatin should be taken at bedtime, and liver enzymes need to be monitored. Now, the next one we're doing is also a statin, and it is atorvastatin under the trade name of Lipitor. All right, everything's the same except the dose can be taken at any time of the day. Also monitor the liver enzymes once they first start and then continually afterwards. And side effect can be muscle pain, so severe that they have to stop taking it. Okay, next is Toprol. Toprol and the one after this is are very similar. They're both metoprolol. The Toprol, you'll see it says XL, okay? So this is long-acting. And the succinate is long-acting. Anytime you see succinate, it's going to be long-acting. So metoprolol succinate is what this is here. It's only dosed at once a day. The suffix is OL, used for hypertension, and it's a beta blocker, which lowers a person's pulse. Should be taken with food. And the most common side effect is dizziness. So look at the next one carefully. Okay, you have metoprolol succinate right here. This is metoprolol tartrate. That makes it short acting. The brand name is called Lopressor. All right, same everything else about it, except again, the only difference is this would be twice a day. So if you have a patient who says they're on metoprolol and they can't remember if they're tartrate or succinate, you can't assume. There could be a reason that if they're dosing outside of what is the norm. But if the patient says they're on tartrate, but they're only taking it once a day, it's something that should be explored to make sure the doctor really intended that. It's unusual, but I've seen it a few times. Prilosec OTC. So the Prilosec that is on the top 100 doesn't specify if it's a prescription or the over-the-counter. Trade name is omeprazole, but this is another one that can come both ways, kind of like ibuprofen. So over-the-counter is 10 and 20 milligrams, and prescription is 20 and 40 milligrams. Prazole is the ending, and you'll see there's a few of those. When you see that ending, you know it's probably a proton pump inhibitor. And that is a acid reducer. Reduces the stomach acid. Should be taken 30 minutes before eating or on an empty stomach. And the reason for that is because when you're taking the first bite of some food, you start to salivate, and your stomach juices actually start to secrete, and acid gets ready for a meal. So the idea is at least 30 minutes ahead of any food or any meal time, you take your Prilosec to shut the parietal cells off that secrete the acid. And it works much better that way. You can also take it it lasts 24 hours. So you can take it at bedtime if your bedtime is an empty stomach, meaning 2 hours after you've eaten. Then you have 24 hours of coverage. So that's also a very good time. Either 30 minutes before breakfast or at bedtime. Okay? Now, because there's a low acid environment in your stomach now, if you take this every single day, which some people have to, then they're going to have less acid in their stomach, and it will be difficult for your body to absorb minerals like calcium, iron, magnesium. they're actually like rocks, they're just not easy to absorb. So it's really important that the patient has their blood work checked, make sure that they are taking calcium, extra calcium, and vitamins, because it's not going to all get absorbed from their diet as it normally would. So it's important to know that, because if you're, especially in the women, because after age 30 we aren't making bone anymore. We're either going to keep it or start losing it after age 30, and that's just the way it is. Men have a longer their bones don't deteriorate as quickly as ours. So women on this daily might need to take calcium earlier, and in addition to their multivitamin. All right, next we have hydrocodone, tartrate. We don't need to say the tartrate, just so you know, but it's there. And acetaminophen, also known as apap. Now, this is a combination medication. It's an analgesic with an opioid. Okay, Norco and Vicodin are the brand names. It is in the class of opioid narcotics with some Tylenol in it, which helps with pain also, but also helps with fever. It's used for severe acute or chronic pain. And the acute means something that is going to be, or figured to be, a short duration. So you just had surgery, maybe you had the wisdom teeth out. That would be acute situation. Chronic could be someone with rheumatoid arthritis. They have to take it every day. Side effects include CNS depression. That is central nervous system depression. So all the side effects that go with that could be sleepiness, sedation. That's what sedation is. Slurred speech. Motor skills are kind of off, tripping, falling. So it's very important in an elderly patient to give them the warnings that this can make you dizzy. Also can cause respiratory depression, and that means your breathing will slow. So if a person's abusing this medication and they take 3 or 4 of them, their respiratory is really going to slow down. And if they combine that with other things that do that, like alprazolam, like benzos, I haven't gotten into that yet, but things that are used for anxiety, other medications that cause you to be tired, or alcohol, that combination can become deadly. So this is a class 2, and again, it has a C2 up here, Roman numeral inside of the C, because it is a controlled 2 or class 2 or schedule 2. Those are all the same, mean exactly the same thing. Substance. So it's highly regulated, cannot be refilled. If your doctor orders 10 pills and you need 10 more, doctor's going to have to order another prescription. And it has some box warnings. In fact, you should look them up. There's lots of them, including, dependence, and respiratory depression is one of them, and potential for abuse, things like that. Also, the person that takes too much of this is going to be taking too much of the apap, too much of the Tylenol. That's really bad. That can cause liver damage, and that can be permanent. Next and last, we have Norvasc. Norvasc is a calcium channel blocker that goes by the generic name amlodipine, and it's used for coronary artery disease and hypertension, and swelling or edema. Retaining fluid is the most common side effect. Okay, so that's really good to know. And fill in, I hope some of those little things I just told you will be good for, the notes that you're taking. But the things I told you, and I'm going to be telling you in the 10 that I do at a time, are the kinds of things test questions can be built out of. Okay? All right, so good luck with everything, and we'll see you in the next video.